Good afternoon, everybody. I'm Dr. Matthew Sutter. I'm the Allen County Health Commissioner. And I want to talk to you about where we're at, where we've been, and what I expect going forward. Behind me are a number of representatives of business, of the community, elected officials, who all represent different interests, and who all have been affected and will be affected by this ongoing pandemic. So where have we been? It's been a long year. People are tired. If we look at April of 2020, the pandemic was just starting to really take shape. We were starting to get information, but there was so much that was unknown. And we know a lot more now, but we still don't know everything. What we saw is we saw our cases across Indiana, across Allen County, come up and then stabilize through the summer. When the color codes went in, we stayed in yellow. And I was feeling pretty good all through the summer and coming into the fall that maybe we would escape this. Maybe we would not see catastrophe hit. Maybe our hospitals, our healthcare workers would not become completely overwhelmed. And then in November, I stood here and announced that we were seeing a big surge. At that point, we were doubling our cases every week. Our hospitals were filling up. Our healthcare workers were becoming overwhelmed. And the governor had enacted a series of restrictions, and I extended those because I didn't think they went far enough. We did see our cases continue to go up and then peak and then come back down. And through the winter, they've now come down, and we're now at a steady state again. It's slightly higher than we were in the summer, but it's much more manageable, obviously, than we were in the winter. So we're in a much, much better place than we were in November. But the pandemic is not over. We've seen tremendous penetration of vaccines in the over 65 crowd, and age is the most important vulnerability with this disease. That puts us in such a much better place. And my take is, even if we see a huge surge at this point, I don't think we will completely overwhelm the hospitals. But I don't know that for sure. And if this virus has taught me anything, it's that when I think I've understood it, I don't. So, where are we at today? Better than we were, not completely done. As we all know, the governor announced last week that he'll be rolling back the mask mandate in most public spaces. Now, not in all. The mandate continues in state buildings, it continues in schools, and it continues in vaccine sites and testing sites. So there are still mandates for masks in certain locations. I've had the option to place a broad mandate for the county, and I'm choosing not to do that today. There will be no mask mandate for Allen County at this point, but I reserve the right to do that if we see a surge in cases. What I would be looking for is if we get into orange with a significant increase in hospitalizations, or we get into red, then I believe that a mandate and other restrictions will be in place to stop the surge. Now, I don't think that we'll see the catastrophe that was the potential through the winter, but if we don't keep the cases down as the vaccines continue rolling out, I'm concerned that people will die who don't need to die. This is still a deadly virus. More than 65% of people over the age of 65 have either signed up or gotten shots. That's huge. That is by far the greatest risk factor, and it's a vast majority of people who have died. About half the people who have died of this disease have been in skilled nursing facilities, but the other half have not. But about 80% of them are over the age of 65. Those shots in arms of people over the age of 65 are huge, and they are ongoing. To me, the end point is this. Once everybody who wants a shot has had the ability to get their shot, then the point for local restrictions, in my mind, goes away. At that point, people are choosing to ride a motorcycle without a helmet. Now, I don't ride a motorcycle, but if I did, I'd wear a helmet. I'm not requiring people to wear a helmet, but I think it's really a good idea. And from a public health standpoint, we like people to ride their motorcycles with helmets. However, as people are not yet vaccinated in this community, it's not riding a motorcycle without a helmet, it's riding your car without brakes, which doesn't just affect you, it affects the people around you. So it's basketball season, but I've got a football analogy. There's no Indiana teams in the tournament anyways at this point. So. We are on the 5-yard line. We have driven down a long way. There's been a lot that we've been through. But now is not the time to spike the ball and start dancing. We need to continue doing what got us here. We need to continue moving on. So, to that end, I've worked with a number of leaders throughout our community who believe that the right thing to do is to keep wearing masks, to keep social distancing, and to encourage people to get vaccines. To me, that's the way we keep the cases down, and that's the way we get out of it, is by vaccinating. They're standing here behind me. This is a representative. There are many, many more who are not able to be here. I'm going to ask a number of them to come forward and speak and just give a brief capsule about what they're choosing to do within their organizations. Not because the government tells them to, but because it's the right thing to do. So to that end, I want to start with Commissioner Brown, if you wouldn't mind standing up, coming forward.
Thank you, Dr. Sutter. I think one of the things that really comes to mind is that we truly have, to your point, come a very, very long way. It's been a struggle for everyone, not only us in government, but in business as well. So to your point of trying to continue masking up, social distancing, doing those things that are in the best interest of your community and yourself would be greatly appreciated. And again, not mandated, but just, again, common sense. And so to make sure that I state this accurately and appropriately from an Allen County perspective, we want you to know that we are following the lead of Governor Holcomb as it relates to mask mandates and crowd restrictions. So therefore, we will continue to require face masks to be worn by the general public and in all county-owned buildings. And this requirement will remain in effect until further notice, and it will be reviewed periodically as we, again, engage with Dr. Sutter and his team to discuss, and as, again, you know, the governor as well with his authority in play. Whatever those things play out, then we will follow it accordingly. So we want you to be aware that one of the things that this whole process has taught us is that private business is extremely important to us. We want business to remain open, and we ask that in the same vein, that if a business decides that they want to continue to mask in their particular environment, please respect that. Please mask up. We want people to be safe. We want those businesses to continue to thrive, and we want those businesses to remain open so that we can do the best we can to be as normal and doing our day-to-day as we possibly can. So it's important for us to consider all of these things for the health, welfare, and safety of our community and for each other. So continue to mask, continue to social distance, and please continue to do those hygienic things that are in the best interest for yourself and for your family. We're almost over the hump. And again, it's just one of those things from common sense that I would always say that all those things that your mom taught you, keep doing it, because it's, again, in our best interest and shows what this community is made of. So thank you.
Thank you, Commissioner Brown. Mayor Henry?
Thank you, Dr. Sutter, and thank you for all the work that you put into this decision-making process for the County of Allen, obviously for the City of Fort Wayne. I had a number of analogies that I wanted to use as well. One of them was football, one was basketball, and several others, but you've used them all. So I really don't have much to say at this point, other than to say that the City of Fort Wayne will also continue to require masking in all municipal buildings. And my intent is to keep that masking in place until at least July 4th of this year. Because on that particular day, if all continues to go well, there will be a real reason for the celebration of independence. Now, obviously, as Dr. Sutter said, if we move to a different color, we'll have to reevaluate that. But if conditions stay the way they are now, our desire would be to remove the mask mandate from all municipal buildings and bring all of our employees back who are currently on hybrid schedules. We feel that that is a sufficient amount of time, 90 additional days for the citizens of Fort Wayne to go through a pretty thorough vaccination process. We'll be able to really determine by then the condition of not only our city, but our county, our state, and our country. But I guess what I'm saying is we will also follow what the county and what the state are doing for their employees. Thank you.
Thank you, Mayor Henry. Next, Mike Nutter from Fort Wayne TinCaps.
Hey, good afternoon, everybody. If they're using sports analogies, I'll use the best sport out there. I don't know if we're in the ninth inning yet going to the closer when we think we've got to win, or if we're at the seventh inning stretch, but we've come a long way. But we're not quite there yet. And we missed everybody last year, and it really hurt, our private business. But a lot of people felt the exact same way, and we cannot wait till May 4th to start welcoming people back. But it's not time to welcome everybody back in that award-winning ballpark with a full capacity yet. It's just not. And so to that end, there's going to be social distancing in place, and there's going to be masks required for our great fans that come out. Our intention is to keep them as healthy as possible, along with our staff, our fans, certainly the players that are going to come out here. And so we are so excited. The place will be as clean as it's ever been on an ongoing basis. We can't wait to welcome you back, but now is not the time to celebrate the victory totally in its entirety yet, because we're just not there yet. And we want to be a part of the group that's encouraging folks to continue to get their vaccines. Thanks.
Next, I'll introduce James Kahn from Baker Street, Hoppy, Gnome, and Proximo. If you can introduce yourself too when you come up, that'd be great.
I'm James Kahn from Baker Street, Hoppy, Gnome, and Proximo. Thanks. No, that's okay. I agree with everything everyone has said. To use sports, you can ask Leon Lett about celebrating before you cross the end zone. It's not the time. We're really, really close, and whether the government is mandating that we require masks and social distancing in our restaurants or not, you don't have to tell me to love my kids because it's the right thing to do. So you don't have to tell me to love my neighbors. It's the right thing to do. And if 90 more days or 120 more days gets us to a point where everybody that wants to get vaccinated can get vaccinated and our community is more healthy, then that is a sacrifice that we're willing to make in order to make sure that we get there. So God has brought us through this far. We only have a little bit more to go. And so I would encourage any other people in my industry to follow the same suit and try to do the right thing to get us so we can get back to normal. So, thanks.
Next, Pastor Luther Whitfield from New Covenant Worship Center.
Luther Whitfield from New Covenant Worship Center.
Senior pastor.
Senior pastor. Well, thank you for that. Everyone used an analogy, so I'm not going to do that. I'm simply going to recall what Paul said to the church of Galatians when he simply said, let's not get weary in well-doing, for you'll reap a harvest if you faint not. And when I think about that, and as for many of our churches are approaching and opening our doors, for some for the first time, for some who have been open for a while, but as we are in this Holy Week, and many will come together in celebration, we want to get behind and support the wisdom of all of our healthcare workers and our State Department of Health, as well as follow what I believe the city is doing on a solid, strong move, and encouraging everyone to continue to wear their masks and continue to social distance, continue to be mindful of sanitizing, washing those hands, so that everyone can be safe. As we gather this week, we want to, as pastors of this community, to make sure that our flocks are safe, our children that come in are safe. And so as we celebrate this week, we want to continue to make Fort Wayne what it is and has always been, a great city and a healthy city for each one of its residents, and particularly for our churches, our parishioners that God has brought into our fold. Thank you.
Thank you, Pastor. Herb Hernandez from Hispanic Chamber of Commerce.
Thank you, Dr. Sutter. For a second there, I thought the pastor was going to, he was on a roll, and I thought he was going to start asking for an offering.
But they told me no play.
But seriously, the Hispanic Chamber really is promoting getting the Hispanic Latino community to get their vaccine shots. And it's very important for the Hispanic community to listen and to follow the instructions of the physicians and the medical scientists. It's very important for their health, to protect their family and their friends. Now I want to say this in Spanish. Para los que hablan español, es muy importante que escuchen y siguen las instrucciones de los doctores, médicos, de ponerse mascarilla para su salud, para proteger su familia y sus amigos, y que vayan con Dios. Gracias.
Thank you, Mr. Hernandez. And Marilyn Hissong from East Allen County Schools. Certainly not.
Oh, okay. Good afternoon. As he said, I'm Marilyn Hissong, Superintendent for East Allen. Almost a year ago, I was reflecting back on this. There was tremendous uncertainty, to say the least, in K-12 education around COVID-19. If you think back, we were just making the final decision about this time that we were going to be virtual for the remainder of the school year. And that was a big change for a lot of our local schools. If you flash forward a year later, I can say these things with certainty. We have completed, as of today, 151 school days and in-person instruction with virtual options. And when students return from spring break, which is April 12th, we will only have 29 days remaining in our school year. So in order to accomplish that, I have to look back, what can I attribute that to? What we are doing to mitigate the virus from spreading in our schools is working, as evidenced by 151 days of in-person, instruction. We're social distancing, we're hand sanitizing, we're doing the extra cleaning, we're wearing our masks. So my last comment that I really want to drive home, finally, I can say with certainty that the success we have experienced this year is because of people coming together. My sincere appreciation to our parents, to our students, and to our staff and the communities, and especially our local health department. It has and continues to make all the difference in our schools. And I want to leave one last thought. We talk about grit in education. It takes grit to accomplish a hard task, whether it's an assignment or even learning something new. It is going to take grit for us to finish strong. And to leave with Dr. Sutter here, I would say we need to make it to the end zone together. Thank you.
Thank you, Marilyn. So what you've heard here is just a snippet, a sample of our community coming together saying this pandemic is not over. We need to come together as a community to keep each other safe. Well, I've been vaccinated and I feel no fear of acquiring COVID. There are many others who want to be vaccinated who are not yet able to, and we need to keep them safe because right now they're still not. We have been remarkably blessed. We have 3 vaccines that are approved right now, which have been 100% effective against hospitalization and death. That's far outstripped my expectations. I had hoped we'd have effective vaccines. I'd hoped we had safe vaccines. And we not only had that, we have vaccines that have been 100% effective against hospitalization and death. Not one person who's been fully vaccinated with any of these vaccines has yet died of COVID-19. Now, someday somebody may, but that's a tremendous track record when we have more than 130 million doses given throughout the United States, and many more than that throughout the world. We have not seen adverse effects outside of a few allergic anaphylactic reactions, some of them serious, but very rare. People worry, could there be long-term effects from the vaccine? Well, if you ask a scientist that, they'll never say no, because almost anything's possible. But in the past, the vaccines that have had serious problems, and there have been several, all showed up in the first 6 weeks. We are far beyond that, with no evidence of significant adverse effects. And that needs to be coupled against what are the adverse or long-term effects of acquiring COVID-19, and we know that there are many. Many people seem to get it and have no symptoms and seem to be fine afterwards, but there are large numbers of people who have long-term effects who did not die, but are disabled in a number of ways, including lungs, heart, and nerves, or people with long-standing symptoms. So when you compare the likelihood of long-term effects from the disease versus long-term effects with the vaccine, there's no comparison. So I would urge everybody to get their vaccines, everybody who's eligible, that's over 16 at this point, so it's almost It's all adults in the state are currently eligible, and only a handful of people who have restrictions that don't allow them to. I understand that not everybody will take advantage of that, and that's a personal choice. But for now, there is a choice to get the vaccine, but people don't have as much choice if they want to get the vaccine and have not been able to get it yet. So we need to keep them safe for a while longer. So thank you for being here. Happy to take any questions or direct those to people in the audience here, or people who are behind me here. We'll start with that. So Corinne, I see you've got one.
Dr. Sutter, we have experienced throughout this year of the pandemic that people show up in hospitals.
Yeah, so the decision to not place a local mandate, a local mask mandate, was not something I took lightly. It's something that I sought counsel with, both inside our department and outside our department. I listened to many voices. I spent some sleepless nights at 3:30 in the morning thinking about this. And in the end, what I came down to is, in November, I felt like I had a clear mandate. There was a clear public health emergency of the ability to completely overwhelm our hospitals and cause great death. I don't feel that same thing now. There is still a concern, but it doesn't rise to the same level. And while I think government needs to take a role in helping people make good decisions, and sometimes we do that by restrictions, I think it should have the lightest touch possible. So when it came down to it, I didn't feel like we were there. However, if we start to see a spike in cases, if we start to see a spike in hospitalizations, then I think we're there, and I would strongly consider local restrictions.
How about capacities in businesses and things like that? Where do we stand regarding that?
Yeah, so the governor's order does not include any restrictions at this point. What we know is, and we actually know this, one of the reasons I wanted Marilyn here, we know this from schools, it is possible to have people together inside relatively safely, but they've got to wear masks and there has to be some level of distancing. We would encourage everybody who's doing this to follow those things. In addition, once people have been vaccinated, the CDC has clear guidance on this. Once a group has been fully vaccinated, it's okay to congregate indoors together or with a single family as long as nobody who's not been vaccinated is not high risk. Sorry, that's a lot of dangling modifiers, but basically, the vaccines are helpful. They're not a perfect answer to us yet, as we're incompletely vaccinated, but there are ways to gather safely indoors. We would encourage people to do that.
Will businesses and events have to continue working with the Department of Health for big events with numerous people?
Yeah, so there is no requirement for them to work with us. However, we are going to be available to provide assistance. We are working on signage, and we're working on a set of recommendations for businesses to follow and allow them to post signage saying they are following these safe principles, which are the things we've always been saying. It's wearing a mask, social distancing, washing hands, and getting a vaccine when you're eligible.
Did you say what the percentage is of people in Allen County who have been vaccinated that are able to at this point? Do you know that?
I don't have that number right off the top of my head. I'm sorry.
Dr. Sutter, you mentioned it earlier. The people who are most affected by COVID-19 and passing away from it. Work with the senior living centers to keep them safe, that when people who are not vaccinated, even though it's maybe not a mass mandate, to keep those persons that are not vaccinated from infecting others.
Yeah, so the question is about nursing homes and vulnerable populations. You know, fortunately, we have seen excellent vaccination rates throughout that. The most important tool we have around this at this point is our vaccines, because so far they've been 100% effective against hospitalization and death, even for people who have significant medical conditions that place them in a nursing facility. The state handles that rather than the county, but there's been really good movement towards that, and my understanding is inside the county, the nursing homes have had excellent vaccination rates. That's our most important thing. Now, we are still encouraging reasonable restrictions with that. So if people have not been vaccinated, people should be masking around them. People should be social distancing. And even if they've been vaccinated, there are probably still some things that we want to do to keep people safe. But the experts said a year ago that we would vaccinate our way out of this crisis, and that's what we're seeing. We're not quite there yet, but we're very close.
A question for Marilyn Hissong, for one. Sure. Just kind of going into the fall, I know the summer there's going to be a lot we find out as far as kids possibly getting vaccinated. You know, how normal are things going to look going into the fall? What will be kept going forward that,
Pretty easy question right now because it's to be determined. I don't know that we're ready to make those. We're honestly just trying to finish this school year, get through our graduations. We want to celebrate right now with our students. I mean, proms and graduations, things that we lost last year, those are the capsules of, you know, the senior year, and we're losing them. We've lost them in the past, and so we want those this year. So we're doing everything we can right now to focus on this year. We will be making plans, obviously, working with the local health department, working with all of our local schools. We cooperate very well together to make plans for the fall. So I can't tell you exactly what it's going to look like right now, but in a perfect world, we would love the normalcy. You know, all of us would. But we want to be safe. First and foremost, that's the most important thing is when parents send their kids to school, they want us to keep them safe. And we want to make sure we can do that.
Pressure that you felt, I'm sure you had to feel some of this, that from forces that really wanted this lifted and did not want to deal with this anymore. Did you catch a lot of that? I know there's tons of people out there that feel that the mask mandate's a good thing too, but did you also feel a lot of pressure from that other side saying that, you know, how much it was important to lift some of these restrictions?
You know, there's been pressure from both sides all the way through. I mean, there's obviously, in my opinion, there's a vocal minority that is really against masking and vaccinating, and I think that's unfortunate. My impression is that the vast majority of people fall somewhere in the middle. They're not quite sure what to do. They don't really like wearing a mask, which is also true of me. I don't particularly care for wearing a mask, but they understand the necessity. And they're listening to experts. They're listening to people in authority who are, I think for the most part, really basing things on science and basing things on relative common sense. I have to say I've gotten a lot more thanks than I have hate over the last year, and that surprised me. And I think it just goes to the kind of people who live in northern Indiana. There are certainly some people who feel very strongly that everything I've said or did and every restriction is the wrong thing, and I'm the enemy, but I think the vast majority of people have appreciated it. Very good. Well, thank you so much for your time. I really appreciate it. Thank you all.